The wastewater collected has been diluted considerably. Only 50% of infected people excrete SARS-CoV-2 into their poop, and different people shed different amounts of virus. With all of these factors, and given that SARS-CoV-2 RNA concentrations in wastewater are not direct COVID-19 numbers, how do you accurately ascertain the number of people infected in a given area by analysing the wastewater in that area? For example, I saw a news report recently that said that you were able to ascertain that Ontario had entered a sixth wave because around 30 to 40,000 people a day were being infected. How did you calculate that?
Hardest question of the podcast.
Yeah, it is, but it's a great question and has to be asked. So, early days, people started to do this, like we talked about March 2020, April 2020, we were getting our first data points in. There are companies and labs that came out, and particularly one US company that provided a service to track SARS-CoV-2 in wastewater and tell you how many people were infected in your community. So this has been something, and it's ongoing now, and it exists. It's that number that you're referring to comes out of the science advisory table in Ontario. So Peter Uni and his group have taken the 107 wastewater treatment plants. There's 175 sites in Ontario. There's 107 wastewater treatment plants. The other sites are what you alluded to, like smaller resolutions, buildings, neighborhoods. And he takes that information and really, through a number of kind of calculations, derives a number equivalent, a number of people in the community. And that equivalency is really based upon the fact that there are some sites like Ottawa, for example, Hamilton, that's been doing this for about 2 years. So you have this relation that already exists. The wastewater signal gives you a value. At that same time, you could look and see a corresponding number of clinical cases over time. And we've seen, we just actually put out a paper looking at this and how that relationship between clinical cases and wastewater signal actually changes when your variant of concern changes. When the dominant variant in your community changes, the fecal shedding seems to be modified, or the people who are asymptomatic, the number of asymptomatics may be modified. I think that the landscape essentially changes and that relationship changes. Right now, we have a relationship between clinical cases and Omicron, was BA1 really, because that's when we were testing here. And that relationship is using to extrapolate and say, okay, if our wastewater is this amount, then we can say it's approximately this number of cases. So that's how that number was derived. It's something that I think is used more so as a piece of information because people are used to clinical cases. I don't think there's a whole lot of precision there, but I think it's very useful as a communication tool so that people in this day and age without the clinical testing anymore, there's that void, it sort of replaces that void, but maybe not a whole lot of precision on those numbers.